My name is Yong, and I'm an interventional cardiologist, diagnosing and treating patients with different cardiovascular disease. I would say I was always a caring person growing up, just the environment and the exposures I had with siblings, being pretty involved in church, going on mission trips, being a volunteer at different youth organizations, helping inner city teens. I went to medical school in Albany Medical College in New York. During the first exposure in the cath lab, where I saw a patient who came in with an acute heart attack, and the acute life-saving procedures they performed on the spot and the immediate impact they made on the patient kind of drew me to the field. Did my residency and fellowship at Loma Linda, Harbor UCLA, and at Good Samaritan Hospital. For a combination of you acting decisively in acute situations and developing kind of long-term ongoing relationship with your patients. And oftentimes we do perform minimally invasive procedures, which is all done percutaneously, which means through the skin with different wires and catheters and devices to treat different various cardiovascular disease involving your coronary arteries, your peripheral arteries, and structural heart defects. My philosophy in medicine is obviously first listening to my patients, showing a lot of empathy, as often our patients are at their most vulnerable state, dealing with a lot of critical illnesses. I'm also a perfectionist where I always need to be satisfied with the results and outcomes of my patients. There's one gratifying moment in particular recently where a patient, he had a heart attack at a different hospital, but he came to us looking for a second opinion, and we were able to provide him with the care he wanted, and he made it out of the hospital, being able to spend time with his family without any more chest pain. And for us to being able to provide that kind of care and being their last option, is very rewarding. I tend to have little obsessive compulsive tendencies, so you have to try to find a good work-life balance. I do often fantasize about being a professional golf player, playing in the PGA Tour. So peaceful. So I'm not good in golf in any way. It's just a fantasy, I said. But I mean, just the nature of the sport, the concentration, the focus, and you have to make time for your family. I have a wife and I have 2 sons, and I've been pretty involved lately, as now that they're grown and they're very involved in school and various sport activities. The greatest strength that PIH Health offers to our patients is the quality of care, the innovative treatment options. The moment I walk through those doors, saving people's lives, touching their hearts, literally, and improving their quality of life. I love doing what I do every day.